All right.
Hi, my name is Lori. I'm going to be your nurse today, Briard. How you doing?
I'm good. How about you?
I'm good. So, you're 21 years old and you're a smoker. It says that you've been having shortness of breath
Yeah.
with exercise. You have smoked for 4 years, it says. Do you prefer smoking cigarettes or do you do vape?
Usually I kind of do both.
Yeah, vaping is actually real hard on the system as well. So that's why I was asking. Do you drink alcohol?
Yeah, every now and
Okay. I see that you were having a hard time of breathing and that your heart is racing with exercise. How does that make you feel?
then. Like when I go on like short walks or anything like that, I can kind of hear myself weeping or like my heart rate kind of speeds up a little bit.
Okay. This is like your third time of coming here into the walk-up clinic. I just checked your blood pressure and it's 150 over 90, which is an elevated level. And I see back here that you have had two other elevated readings of 140 over 90 is a recommendation that it is a high risk for high blood pressure or hypertension. With that, the blood runs really fast through your arteries and causes this condition. It's a treatable condition. The doctor wanted me to talk to you about several things. First off, how do you receive your material? How do you learn?
Usually I get information through other people or like Google something
Okay.
or read
You like to read pamphlets and things like that? Do you understand English written?
Yeah.
Okay. So today I'm going to discuss with you different methods of helping you slow down your breathing when you are having those episodes of shortness of breath. Also, we're going to talk about diet modification, exercise, and quitting smoking. That's a big thing that a lot of people don't know is important to do because it does cause high blood pressure. Another thing is I'm going to show you how to do a proper blood pressure reading. First, when you do get those episodes of having shortness of breath, it's a good thing to do a deep breathing exercise where you take a deep breath in through your nose, out through your mouth, and purse your lips just like that. That way, that gets all the carbon dioxide out of your lungs and it expands your lungs and helps you breathe a lot better, which helps lower your blood pressure and your exertion. So, can you demonstrate that for me? Good, good. So, the next thing we're going to talk about is salt or sodium, is like on your bottle of Sprite there. It says the content. The good thing about having labels there actually tells you how much salt is in that bottle.
Yeah.
It differs from like right here. If you can look on the Girl Scout cookies, where that one would probably say a lot less, but this one says a little bit more because of the content in there. Recommendation is to have 1,500 milligrams a day of salt. But we're recommending that you cut your salt down to 1,000 milligrams a day. That way, that helps lower your blood pressure, lower your risk of heart disease and strokes, and all kinds of other things that high blood pressure can cause. One way of eating and doing that right would be to add more things that have potassium. Potassium is a good nutrient for the heart. You can there's a pamphlet here that I can show you about good eating good vegetables and good um, fruits that will help lower your blood pressure in that pamphlet. It also talks about limiting your salt, your alcohol, and your cigarette intake. Those also cause this condition to worsen. And it's a good thing that you caught it early so that we can get a hang of everything. Now, once you get your episodes of shortness of breath underway, we can start talking to you about exercising walking at least 30 minutes a day will help lower your risk of heart conditions and help lower your blood pressure. Another thing that we can talk about is how to actually um, check your blood pressure. Now this is a manual blood pressure, but normally you would want to go and buy a hand one that goes right on your wrist. You'll read the directions on the side of the thing and you'll put it on your wrist and raise your hand to your heart and press start. That way, that will tell your blood pressure. A normal blood pressure reading is from 90 over 60 to 120 over 80. That's a normal blood pressure. Anything above that is considered at risk. Anything above 140 over 90 is, again, it's a high risk for hypertension. And in the Black community, you have a higher risk of running into things like this. And it also causes a lot of medications that the doctor might prescribe to you might not work just because you are African American. Now, with this being said, we're going to try to teach and educate you on the proper usage of doing shortness of breath breathing exercises, getting getting your salt intake lowered, increasing your potassium intake, exercising, quitting smoking, stopping drinking. We also want to recommend that if you are having issues with shortness of breath and it is not resolved with that deep breathing exercise, or you cannot come back down from that, you need to call immediately to the clinic and talk with the doctor. Do you understand any of this?
Yeah.
Now we can talk a little bit more about the blood pressure, but right now I'm going to start you with some materials that will help you stop smoking and some exercise that you can actually take and do. Are you comfortable with what I have taught you?
Yeah, I think that was some good information.
Okay. Right now, the doctor does not recommend any medications, but if there is no change within a week, we're going to have you come back in a week and see how your blood pressure is next week with the diet modifications and trying to do your regular checkups of your blood pressure. A best time to do it is in the morning.
Okay.
You know, check it whenever you're bright early. I know smoking and all that is going to cause a little difficult for you, but if you stick with it, you're nice and young. You can make this into something that is a treatable condition. Thank you for your time.